Hello, everyone. Nyao Zhong, and welcome to the Hmong Medical Association COVID-19 series. Today, I will be talking with a recovered COVID patient as she describes her experience and what it's like to have COVID-19. Nyao Zhong, kuya Dr. David Thaw, nuno kuya Nju Kathy Mozabo Tang. Kathy, ki tao tuka mo COVID ko jua, mo tu mong nu zhong le. Ni yo ka pi tu tu nu ka experience la ya, hata tuka mo no nu zhao nu zhong le jiang. Welcome, Kathy. Thanks for
Thank
joining us.
you. Oh yeah, thank you, David.
Yeah, I appreciate you coming here and kind of sharing your experience with us. It's really important to get the knowledge and the experience and education out to the community so they can kind of relate and help themselves and prepare as well. So thank you so much. I appreciate it.
Oh yeah. Oh, absolutely. It's my pleasure. And I really appreciate the series that you're doing because I think going through the experience, a lot of it is also trying to figure out how to share your story. You know, and part of it is to both talk about the severity of it, but also to provide a little bit of hope, you know, because I think a lot of the news that's out there is can be really depressing and can be really scary.
Absolutely. So I just want to start out by you kind of just introducing yourself, tell us a little bit about yourself.
Okay. Yeah. So my name is Kathy Mochapao. I live in St. Paul, Minnesota. I've been here my entire life. I'm the executive director of an arts grant making organization in the Twin Cities, and I've been working in the arts for most of my professional career. I used to be the executive director for the Center for Hmong Arts and Talent. And yeah, I, again, Kathy Mozapo, Kunyo St. Paul, Gu Oholuto Ilukong Hao, Ban artist, Nyaho St. Paul, Nyaho, Minnesota. I don't know. What else is there?
No, that's fantastic. Thank you for telling us. Hubao Kathy, they need to numua pixihing had to art man. She's so talented, so skilled. So so it's an honor to have her come talk to us. So Kathy, I'm so happy that you're willing to kind of share your story. Experience. Trong tu come on, Jean Le Tian bé tu cái tim mong thằng ha thì sinh nhật tu lâu rồi là bây giờ muốn cho cái ý xong thì được cho tu cái món là thì được rong là thì bé mà rong sang thì khi mà có有一度整路整 very healthy 那个那种就是个好对个找tu cái món là ha là thì cũng sang có share cái好 experience 这边个从那这都就好tu cái món là covid 个就mà你chỉ discriminate lâu rồi so that you you know, and so I want kind of just to kind of us to have a kind of conversation about what happened and you know, so we'll start from the beginning. Kathy, how old are you?
I'm 40 years old. I'll be 41 in May.
Okay, super young. Super young. So that's why
absolutely young at heart.
Yeah, super, yeah. That's why it's important because not you know, COVID can hit you from any age as well, and that's a good prime example of being young and healthy, and you can still get it. But then, you know, majority of patients with COVID will do well and will recover. You know, so prime example. So tell us, Kathy, because you had to come on be like, you know, how long ago?
Yeah. I would say that the first sign of any kind of imbalance that I experienced was, I remember it very clearly. It was March 9th. It was Monday. You know, it was a regular day at work, but that was also the first day that we had sent out a mass email to our listserv about just the things that we were doing at work to kind of lower the risk, but also asking folks that, you know, if they felt any kind of illness at all or any kind of imbalance to not come to the office, right? And so that day went by just normal. And it wasn't until the very end of the evening, right before I went to bed, I felt a scratch kind of in the back of my throat. And it was, you know, it wasn't just like a little scratch, like you could just clear it, like, you know, it was like significant enough for me to pay attention to it.
Yeah.
But it was just a scratch, right? So then I went to sleep. I actually slept through it the whole night, no problems. And then I woke up the next morning with a pretty severe cough and a sore throat. So, kusate, you know, I just thought I would work from home, right? But the next week was pretty brutal. You know, it continued to progress. There was congestion, headaches, fever, chills, sweats, you know, I mean, right? So I realized very quickly that I was not even going to be able to work. There was also a lot of cognitive. I mean, I was cognitively not fully alert, right?
Okay.
And when I think back to it too, I realized that actually I slept. I mean, most of the time I was asleep because
you were really tired.
Oh yeah, you know, and I think you know, like my body was just trying to fight it. And I think this is the first time I'm a fairly healthy person, so I don't really get sick that often. But I would say that this is the first time where it felt like I could feel the virus, and I could feel my body trying to fight it and overcome it, right?
You've had flu before, right? You've had like flu like in the past?
I think so, you know.
How's it different than that? Like what kind of...
You know, I think it's very similar. I honestly, I didn't think I had COVID. I thought for sure it was just the flu. I think some of the similarities are called umbara, right? So like you ping the fever and the chills, you know. I would wake up sweating, you know, but then I would go to sleep with chills, right? And I think another thing, so you hear the symptoms around like having a dry cough, but I actually had a very productive cough. So I thought, oh, this isn't it, right? I think also, you know, they talk about shortness of breath, and I think that actually is probably interpreted differently by everybody. You know, I heard some people saying when you have shortness of breath, it means that you can't say a full sentence without running out of breath, right? And I was like, oh yeah, I can do that, right? I can say a whole sentence without running out of breath. But eventually, I did feel a real tightness in my chest that started to make me worry, you know?
Yeah.
And I kept asking myself if that was the shortness of breath, right? But I think there's a certain level of denial, you know, that I went through also. And so I just kind of brushed it off as like being a really severe cough. And because I was coughing so much, my chest was hurting, you know. But so for a couple of days, I was kind of in and out of consciousness. And every time I woke up, I would research how to get tested for COVID-19.
So now you're kind of concerned that you might have COVID, right?
Well, I also felt, you know, I felt like I had a responsibility to my staff, my team, and my workplace. And, you know, and I wanted to find out because I had been in contact with people too, right? I think there was, so I did feel like a certain level of responsibility. So I was like hustling to find a place to get tested. And so, you know, and so I would just Google where to get tested for COVID-19 in Minnesota. And I expected to see a lot of results, but everything, I didn't see anything. So this is around, you know, March 11th.
Early, yes. Yeah.
Right? And so I didn't see anything that was a direct hit, like this is where you get tested. Instead, I just saw a lot of like articles about COVID, a lot of articles about people dying, a lot of articles, you know what I mean? Just kind of the devastation of it. And then I found there was an article about Fairview and how they were starting to plan for like a drive-through test. So I went to that article, I was reading, and I clicked on a couple different links, and I eventually ended up at their website. And they had this online clinic, you know, which was not free, but I took it, and basically it's like an online survey, right? Have you been in contact with anybody with
there
COVID?
Was no person talking to you? It was just a survey?
No, it was all online, right? And so this was part of the challenge, though, right? It was extremely hard to get tested. So it was all online. It was, have you been in contact with anybody that had COVID-19? Have you been to any of the outbreak countries? And at that time, US was not an outbreak country yet, you know?
Right.
And then the last question was just like going through your symptoms. So I took the survey, I got my results, they rejected me. They said I didn't meet all the criteria.
Wow.
And then they said that I had influenza-like symptoms, but that, they couldn't say that unless you had to get tested, right?
So Kathy, how many days now since your first symptom
So
started?
this
When
is
you
just,
started researching about this and taking the survey?
so I researched every day, but this is basically on the third day.
Okay.
Okay, on the third day.
Okay.
On the fourth day, I woke up and I was like, I need to try this again. I called my insurance. My insurance said, we will cover all the costs for the diagnostics, but we don't know where you can get tested. So
Kathy, do you have a doctor? Like what how come you just didn't call your doctor and ask them?
yeah, good question. So I had a doctor that moved and I didn't follow her. And I have not since had a regular doctor that I've gone to. So that's a recommendation, I think, to anybody, is just to really have a doctor that gets to know you and that you get to know, and that understands your medical history. But again, I think that's one of the things that, like, when you're a fairly healthy person, I think you take that for granted, or you don't, so admittingly, that was something too that I was like, I need to I should have followed her, yeah. So anyways, I didn't have a doctor to call.
Okay.
I had a couple doctors that I had seen in the past, but I didn't feel like we had a good enough relationship.
Sure.
So, and I think there's just something about, like, I can figure this out. I just have to Google it. You know what I mean? But I called my insurance. My insurance, again, they said, we'll cover the cost, but we don't know where you can get tested. So that was really discouraging. I went back to sleep, and then Friday. So Monday was my first symptom. So this is Friday. Okay. So this is March 13th. I woke up that morning and actually for the first time, like, I was a little more energized, a little more cognitively clear. So I was really determined, like, I'm going to get tested today, So I went to Health Partners website, because that's usually where I go, the clinic I go to, and I took their virtual, which is also an online one, got rejected because they asked the exact same questions, and it's yes or no, right? And if you're saying no, you don't qualify, right? But I saw a phone number for a nurse line. And so, to your point, right, this is the point where I was like, I need to talk to a human being, because I felt like there was nuance in my story that I couldn't relay through the surveys, right? Absolutely. So I called the nurse line and I talked to the nurse, and she asked me the exact same questions, which I had to say, no, I haven't been in contact with somebody with COVID, all that. But then I told her, I was just recently in Asia, right? So I had traveled to Japan and Thailand, which are not outbreak countries, but just the international travel.
How long ago?
It was probably about 3 weeks before that call.
Okay.
So I had already passed the 14-day thing, right? But then I said, but my parents were just in Thailand and they stayed with me for 2 days, right? They were no longer staying with me, but this, I think, was enough nuance for her to consider it.
Yeah.
So she said, let me call you back. I'm going to call the clinic and I'll call you back. So she calls me back and she says, okay, somebody's going to call you in 20 minutes. So in 20 minutes, I get a call. And this woman says, here's a phone number for you to call. So at this point, I'm also like, not only have I not been able to find a place to test, now it's a puzzle.
Yeah.
You know what I mean? And I'm thinking about my mom, and I'm thinking about people that, like, would have either given up because it's so complicated and there are so many barriers.
Right.
Yeah. But so I'm like, okay, fine, I'll call this number. So I call the number. It was like a brand new COVID-19 hotline for them. You could tell because, the people that answered the phone was like, they just got trained, But I found my way there, and it was it was a drive-through. It turns out that was their first day of testing. So I think there were a couple of things on my side. I think they were eager to test people. Yeah. Right. I think there was enough nuance in my story to kind of meet their eagerness, Yeah. So I think that I was the third person, because they were still setting up the tent.
Wow. Yes.
Well, because there were 2 cars in front of us, and lurching Kia in and out of the clinic, to bring all the materials outside. And then I got
this is a Health Partners clinic, right?
Yep, this is the Health Partners clinic at St. Paul. It was the urgent care.
Okay. Yeah.
And that was the thing I kept questioning too. Should I just go to urgent care? And I kept calling them, because I also didn't want to put myself like compromise myself too, because I didn't think I had it, right?
Yeah, right.
And I mean, everybody was saying don't. Yeah. So anyway, I got tested, and she told me it would be 24 hours before I got my results, which I thought was
So tell us
amazing.
about your experience getting tested. What was
Oh,
that like? Yeah.
yeah. I mean, it's not a great experience. They swab the back of your throat, which
Okay.
was fine, but it was the nasal.
Oh,
So they put a brush up your nasal cavity
a
to
Q-tip,
the
right? Or yeah,
no, a Q-tip. It's like a itu.
it's like a
Uh, it's like
brush.
a brush.
Yeah,
Yeah, it's like an actual brush. So they
mm,
did it, and they go as far as they can,
yeah.
and so you just kind of feel your whole head like. So they did both sides, right? And it kind of makes you cough, makes your eyes water, but it's a test, right? So then she said it would take 24 hours to get my test results, and I thought,
Okay.
wow, that's great.
Okay.
It ended up taking a week.
Wow.
Oh my gosh. I mean, it was, and I was calling them. So after 24 hours, I called them. They said
Yeah.
3 days. After 3 days, I called them. They said 5 days. After 5 days, I called them. They said 5 business days.
Yeah.
But also on that fifth day,
Mm.
they had a recording because they already stopped doing testing.
Mm-hmm.
So, and the recording was just straight up that like, due to a testing shortage, we're no longer doing tests.
Mm.
And so I made it in just that window. So that I got my test on March 13th and I got my call on March 20th.
Mm-hmm. So, and your symptoms started March 9th. So that was like 3 weeks later, pretty much, right?
When
Like,
I got my
yeah,
results, it's like 2
two and a
weeks.
half, yeah, two
But
weeks
here's the
later.
thing. I mean, I'll tell you, when she called me, so that by the time she called me, I was already feeling much better,
Okay.
right? By that point, I was already like, I thought I was done with it. And then she called and she's like, and of course, I'm just thinking she's going to tell me I'm negative. She's going to tell me I tested negative.
Mm-hmm.
Right when she said you tested positive, it was like, I've never felt that way before. I mean, it was
Yeah.
shock, right? And
Right.
like, then all these things go through your mind,
Yeah.
like,
Tell us what was going through your mind at that.
I mean, I'll tell you that physically, I relapsed for about 2 days. I got a fever again that night. I think just the stress.
From the stress of the news.
Yeah,
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 totally,
it's
because your
real.
immune
I
system
mean,
was down with stress. Yeah.
it's devastating. So I think I felt guilty,
Mm.
right? Which I didn't expect to feel, right? But I think I just started to feel guilty because I started to think about who have I exposed,
Mm-hmm.
who did I get sick? Did I get anybody sick?
Mm-hmm.
You also start like, you kind of drive yourself crazy thinking about where did you get it from,
Yeah. Yeah. Well, what do
So,
you think you got it from then?
you know
What
what?
goes
It's,
through your head?
the possibilities are infinite. I would tell you that. The possibilities are infinite. Um, I was at the Mall of America the
Mm-hmm.
weekend before.
Mm-hmm.
I facilitated a theater show. You know what I mean? I'm a social person too. So
Yeah.
it's just like, being around people is like pretty common for me.
Yeah.
My parents, they ended up self-isolating, quarantining with another couple that was in Thailand, and none of them were sick. So I kind of like ruled them out. And I
Mm-hmm.
was actually just very happy that I got them out of the house before they got sick from me, because I don't think my dad would do very well if he were to get sick.
Okay. Yeah.
Um, so you just start thinking about like, where could I have gotten it? And then it's like, from all the places where there are a lot of people. And then there was also like, did I just get it from brushing up against a wall? You know what I
Yeah.
mean? Like,
Absolutely. The indirect route. People
yeah,
take from that. Yes.
the possibilities just became infinite. And then there was the guilt. And then there was like the vigilance, of like, okay, then what do I have to do? So I asked the nurse, like, what's the protocol? What do I have to do now? How do I contact people? And she said, she said, this is what the CDC says, wash your hands 6 feet away, that kind of self-isolation. I said, yeah, but how do I like, what's the protocol for letting people know? And she said, it's at my discretion, which was very disappointing. I thought, how can we slow the spread at like this, right?
Yeah.
But what I learned was that, for independent testers, right, when they test and you get tested positive, they contact the Minnesota Department of Health.
Mm-hmm.
so the Minnesota Department of Health then contacts the patient, you know, or the person, and will then talk you through like, who have you been in contact with, and they'll contact them. And that helps to keep the anonymity of the person that's tested positive. But I didn't get my call from the Minnesota Department of Health until April 2nd. So, and that's because they didn't get my test results until March 31st. So by the time she contacted me, and she was very apologetic, and I get that everybody is overwhelmed right now, you know, but it did raise concerns for me, like with how the system is working. One, getting tested is almost impossible. When you get tested, by the time you get your results, how many people could you have exposed? You know, and then by the time you get your call to like, to mitigate the exposure, it's already too late, right?
I think you were in the early phase of the whole testing process. Like you say, you're probably the third one tested at that site. So they still had a lot of kinks to work out. What did you do during that, you know, you said you self-quarantined, self-isolated yourself. What were you doing? Like what kind of medications were you taking to kind of protect yourself and protect everyone? Did you just tell everybody, don't come visit me? You know, I think I'm sick, or I mean, how did you convey all that to people so they can kind of stay away, keep yourself safe, as well as you said, keep your parents, keep your family safe and friends safe?
Yeah, I mean, you know, my parents called me every day. My mom was so sad. She was crying, and she's like, I feel so helpless. You know, she wants to come and take care of me, right? But I'm like, no, you can't. I mean, like I said, I slept a lot. My highest temperature was 103 degrees. It was 102.9. So, you know,
right? Or is it
102.9?
102.9. Wow.
Yeah. So basically 103. So at that point, you're just feeling pretty terrible, you know? And so I just monitored.
You were taking care of yourself.
I was taking, my partner was here with me. And it's interesting because, you know, we don't know. So he's a teacher. So he's exposed to a lot of like students every day. Right. So we don't know. That was another possibility. Did we get it? Did he get exposed and I got it from him? But he never got as sick as I did. And he never got tested.
He had symptoms too, or no?
What was that?
He had symptoms as well?
Not like mine. You know, he had a cold, what we thought was a cold. But it was he never had a fever. So it's mysterious.
Kathy?
No, he didn't get tested. It's really mysterious. So I just like, I think some of the things I would recommend is like have a thermometer. You know, every time I checked my fever, my temperature, if it was like 99 or above, I would take Tylenol. That really helped, actually. I'm not, again, because I don't get sick often, you know, so that was a different kind of practice for me to have medicine available. So I would do that, and that would get the fever down. You know, again, my parents called me every day and said, drink hot tea, ginger, lemon, you know, like, and that's kind of like more comforting than it was, I think, really being able to attack the virus, you know.
Did you have any other symptoms like smell?
Oh yeah, I couldn't taste anything.
Your hearing was off, or any GI problems?
Not the hearing, but I definitely lost taste, lost smell. Otherwise, everything else was flu-like. I think that was probably.
What about like GI problems, like digestion problems, or
no,
and
no,
that stuff, huh?
No, and it seems like those types of symptoms I started hearing more about those symptoms after my illness.
Yeah. What was the hardest part of your symptoms? Like what bothered you the most?
I think when my temperature got really high, I felt it was like when I was the most cognitively like foggy. And I think that's something that I rely on, right, is my cognitive clarity, right? And so that was when it was really hard for me to just kind of like be coherent and pay attention. The other thing was when my chest really did start to hurt.
Yeah, the breathing, right? Yeah, the shortness.
Yeah. So I noticed that and this is also like the fear that sets in, right? So I've learned like fear is when you don't really know something and you kind of fill it with your own crazy thoughts, you know? And so like, I remember one night I was laying on my side, and when I was laying on my side, I think because my lungs probably were not spread or something like that,
Yeah.
I was having a really hard time breathing.
Right.
So I had to lay on my back in order for my lungs to spread out so I could actually breathe. And it hurts when you breathe in too hard, right? Or when you breathe like a full breath. So I couldn't get a full breath because at a certain point it just hurts, you know?
Was there any point where you kind of felt like, man, I should go to the ER?
No, I was so fortunate. I never felt like I had to go to the ER or like I really needed additional medical attention.
Yeah, hospitalized or something like that, right?
Yeah. So my heart goes out to everybody that really is experiencing a much more severe version of the virus, and especially for those that have not survived it. But I feel really fortunate to have survived it, have gone through it, and not to have such a severe case. Although, I mean, it was pretty brutal.
Yeah.
There's nothing about it that is should be taken lightheartedly.
Yeah, so that whole time, pretty much like 2 weeks, you were just pretty much inside, right? You didn't go anywhere. You just stayed isolated, and your partner just kind of helped you cook and get things for you, whatever you needed, and shop for you and things like that, right?
Yep. And I think that, so that was the thing too, is that before we knew if I was positive or not, he was going shopping and stuff. And that's part of it too, right? So after that, I was like, you can't go anywhere, like you can't go anywhere until I'm recovered, because I don't know the science behind it necessarily, but I also did not want to be, again, there's this guilt, right? Like I didn't want to be responsible for him spreading it, even though I'm not going out, right? Like
You guys wearing masks at that time, Kathy?
Yeah, I had masks. We have gloves, masks, like, trying to take all of our precautions. But yeah, I mean, that was the thing. It's hard to wear a mask when you're already having a hard time breathing.
Yes.
Right. Like it's hard to wear the masks when you can breathe freely.
Yeah.
So I really just was like trying to give myself as much space as I could to get healthy.
What were you most afraid of when you were sick like that? What was going through your mind? What were you
Dying.
afraid of? Dying?
Yeah, absolutely. I mean, I had to stop reading the news. I had to stop reading the news. I had to stop listening to the news because it was just like story after story, like death tolls, like people not making it, and like these really devastating stories, I do think that I do think it's severe, right? But again, like I said at the beginning, I think that, it is important for people to also just be hopeful, because I think that, like I said, when I found out, I kind of relapsed, right? And so like, I do believe that like your physical, mental, emotional, like health is all connected.
Sure.
And when you start to just, so I had to stop like paying attention to any of the news because it was freaking me out. It was freaking me out. And I think that was the most fearful thing. And then just also thinking about my parents, and just feeling like, I don't want them to go through this, and I don't know if they'll make it through this,
So what was then since you told us about your fear, what was the hope? Like what kind of drove you to say, I better take care of myself because of that? What was that drive? What was your hope to kind of keep fighting and get better?
I mean, I think that's a good question. I think that I love life.
Yeah.
You know what I mean? I love life. I don't just love my life. I love people. I love my community, and I just felt like there's still so many things I want to learn and experience, and so that's always, I think that's just always a hopefulness that I have for life and the way that I enjoy life. Right.
Yeah.
But I think there's also a determination, again, like I said, with getting tested, right? And then part of the reason why I felt like this was, why I appreciate this program, I do think it's important to be able to share stories of people that survive this. I think that we are experiencing a time in history that is unprecedented, and it's like everything that I read, by the time I read it, it's already outdated, right? Like there's so much uncertainty right now. I think we're all experiencing a level of trauma,
Yes.
You know, like we are experiencing trauma and the uncertainty, the anxiety and the fear. And I think it's important to hear stories about people that survive, because we all need hope right now.
Mm-hmm. Fantastic. Especially all the stigma that goes around,
Oh,
this.
I'm glad you brought that up, actually. I think that when I went to get tested,
Mm-hmm.
I actually thought, like, it really sucks to be Asian right now, and I thought that it was a thought that went through my mind, and right away I also thought, like, God, like I'm sick. I shouldn't
Yeah.
have to worry about the racism and the
Right.
discrimination, right? And
Right.
then when I found out too, I think that um, in addition to the guilt and the fear and all that stuff, there was just like also the social stigma that I really was that was kind of paralyzing me.
Yeah.
I think both, like, within the community, just in general, right? Like it's a plague, basically,
Mm-hmm.
and you don't want to be associated with it. Nobody does.
Mm-hmm.
But then there's also that added layer of, like, being an Asian statistic and being an Asian person with it, and like
Right.
there, I'm a statistic, and for anybody that wants to discriminate, like, I'm verifying something
Right.
for them, and so
Yeah.
there's just that added layer that nobody needs, and that is actually uh, unnecessary.
Right. Yeah. So tell us how you're feeling now. Like how many weeks until you kind of felt like I'm kind of back to normal?
Um, I would say that it did take several weeks before I felt like 100%. Like I felt confident, you
Mhm.
know, because I think there's certain things too, right? Like I started to become more vigilant with just everything that I was doing, because I was so hyper, like, conscious of, like, exposing people.
Yeah.
Um, and so it does take a couple weeks. I think that, like, the recommendation is 14 days, but then, like, you want to throw another week on there just to
Yeah.
be 100%,
Right.
sure.
Right.
Absolutely, right now. And then also at that time, there was research that was coming out that was saying that once you have it, you're immune to it, right? So that was really exciting. And then
Mhm.
I think maybe the week after that, there was new research that said, well, you could possibly get it again. um, I will say that, so right now I feel like I'm 100% back to
Yeah.
myself.
Your breathing is fine, and
Yep.
you still have like residual tiredness or shortness of breath, or
No, absolutely no symptoms. It's probably been uh, more than 3 weeks since I've had my last symptom.
great.
Yeah, I'm hoping that I'll be able to donate. I mean, this is another thing that I'm hoping they'll be able to figure out, but just being able to donate plasma,
Plasma, right?
yeah, I think that they, similar to the testing thing, are still trying to figure out their systems and their eligibility or their criteria.
Yeah.
We've had a couple of hiccups, but I'm looking forward to just be able to contribute somehow
Perfect.
in that way
Yeah.
too.
Great. So what's your advice to um, the community out there in terms of sharing your experience? What's your advice to someone who is experiencing the symptoms, having some kind of doubt or feeling like, oh, I don't know if I have it or not? I mean, what's your advice, being that you've gone through this, you've done well, you're back to normal 100%? And what would you say, looking back, these are the advice you would give to people?
Yeah, I mean, I think that it was exactly the advice or what we were asking for then, right? Like, as soon as you feel some imbalance in your body, so I think part of it is just being in tune with your body, right? So that you can pay attention and that you're aware when something is off. Um, but I think that if you feel something, be honest with yourself and be honest with the people around you. I think that there is very likely so much stigma and fear that people just try to ignore it. Like, oh, I'll just get over it, or I'll just, and they minimize the potential of any kind of imbalance,
Mhm.
right?
Yeah.
So I would say that as soon as you feel something, pay attention to it,
Mhm.
and act on it. Like, be honest with yourself. And if you have other people in your house, like, self-isolate.
Mhm.
Like, I mean, there is no room, no matter how big your ego is, it is not going to,
Right.
it's not going to beat COVID. You know what I
Yeah.
mean? So, like, just be honest and address it, right? So I
Mhm.
would say self-isolate, because you want to make sure that you're not exposing other people.
Yes.
And then just really kind of monitor yourself, get a good book and just, like,
Yes.
You know, because I think that's the other thing. I mean, that's the thing about this virus is like with most other illnesses, cancer, like even some of the worst, you can still have people around you, you know,
Yeah, for sure.
and there is something really debilitating about not being able to have like social interaction.
Yeah.
But you know, it's 14 days, isolate yourself, pay attention, make a plan with your family members, or if you know, if you live with other people,
Mhm.
right,
Yeah.
like have your own wing.
Hmm.
um, if you have to if you can get up and cook for yourself, you know, all those things. um, or if somebody's going to cook for you, just leave it outside the door or whatever, you know, be vigilant.
Yeah, perfect. Well, thank you so much, Kathy. Thank you for um, giving me and everybody this opportunity to kind of listen to you, listen to your story. I mean, it matters so much because, you know, like I say, you know, eventually we're going to know somebody that's been affected by this. It's going to hit us at home. We're going to know someone who has, you know, this worst case scenario where they've passed away and have not made it because it can be unpredictable like that. So I want to kind of thank you again for coming and sharing this experience with us. It's very important to listen because, like you say, all you hear is the depressing news, right? I want to just tell everybody that 80% of the time you're going to get better. Most people survive, and most people back to normal. You're not going to have any residual problems because you're young and healthy, and so I thank you for kind of giving us your experience from the first day you were sick until till now. And so so we're so happy with you. We're so blessed to have you strong and vibrant and contributing to our community.
Thank you, thank you.
Yeah.
And like I said, I really appreciate that you're doing this. I think that everybody, you know, it's one of those things too where you feel like it happens to other people, or you know what I mean.
Mhm.
And so like this is really an opportunity also to like, hopefully people that see this will recognize that, you know, it's very likely somebody in their own community or in their own circle of networks.
Yeah. So thank you. So I think just to summarize, Kathy's experience is unique and is at the same time very common. So everybody can have different symptoms, can have different experiences with this COVID. So in the beginning, she talked about denial, right? She's like, oh, it can't be. So denial is definitely part of the feeling. And I think that's why we wanted to talk about this, because we want to bring out the inner feeling so that people can either empathize or can and kind of help their own feelings guide them through this process. So denial is something that will come when you get this fear, right? You're afraid, oh man, I don't know what's going to happen, and like Kathy said, I'm going to die, I can't breathe, and I have to know myself. So so that perfect example, she said, I know myself, and that's not how I usually am. That's not how I usually feel. So it's something different. And so when you do that, then you want to be honest with yourself. Like Kathy was like, yeah, I'm totally, I feel guilty. I don't want to infect other people, or I don't want to have this kind of go on any further. And so she was honest with herself, and then she started to protect herself, protect her family, protect her loved ones, her friends, and everything else. So those are the points that we take from this. And then the other thing was, another point is that she went to seek help. Right, Kathy went. She went and talked to, did her own research, and talked to the nurses, found places to get tested. So seek help. Don't worry about the
Mhm.
stigma that you're going to feel sick and people are going to look bad on you. That's not the problem. The problem is you have to kind of take care of yourself, seek help, so that if you need to, then the doctors and everybody can help you. And then finally, hope, right? That emotion of hope. She felt like, I can do this, and I can survive. And she said, I have my life to live for. That's what drove me to continue to do my best. My mom, I worry about my mom, my dad, and my friends, and those are all the people that I am fighting because I want to see them again. And so that's all the emotions that we all feel every day. And so and that was the bottom line is everybody, we should live life to the fullest. You know, we should live life and love each other. And, you know, and that's the bottom line. And so if you take care of yourself, you can, you know, you can live that life, you can help other people. And so we're so happy, we're so blessed that you've got better, and nothing worse came from this. And so I want to thank you again, Kathy, for allowing us to have this conversation and share your experience with you. It was wonderful.
Thank you so much, David.
Yeah. Take care of yourself, and hopefully everybody can get this message across, and feel free to share your experiences with each other, because that's how we learn. We share and we go through this together, and we'll all beat this pandemic and get back to our normal lives. So thank you for watching, and everybody stay safe, stay healthy.
Thank you. Bye.